So you can see here with this new Penacam XL wave, I can actually show how we took a patient who's called not a candidate with thin cornea, extremely high astigmatism, that to irregular astigmatism, and did the LaZrPlastique surgery on the cornea. And despite the cornea being the abnormal impact factor, how the final vision, she's beyond 20/20 at distance and near without glasses. Right, Ashley? How's your vision right now?
It's 20/20. Perfect.
Wonderful, wonderful. So that's very important to understand how, to me, there is no such thing as not a candidate as long as you can understand how to break the camera down optically and then surgically use 40 different techniques to get to the visual endpoint. And this is also very well depicted if you look here in her overview, because she's very young right now, but I'm already recording her lens status for the future. And you can keep that in mind as you're looking at the system, look at the aberrations, look at the refractive index and where we are. And we brought her to 0 from her extreme astigmatism and myopia on a thin cornea, on patients who are told they're irregular. There is no such thing. If it's irregular, then you design your surgery to that level safely, because you're also keeping in mind that as she approaches the cataract age, the cataract should be a piece of cake because you fix the viewfinder. Right, Ashley? Does that make sense?
Yes.
She's in the medical profession, so it's fun always to discuss these things. And this is post-op patient. You can see the lens is completely clear, so we went up to the cornea and how we brought it to a regular, beautiful center, very uniform, and that translates to quality of vision. How's your night vision?
Excellent.
Wonderful. Wonderful. And you can read too?
Yes.
Yes, you do all your Facebook stuff all day, I see you.
I do.
But a pleasure. So that's very important with technology, how to take these patients to perfect vision, and they are candidates. You just have to try that hard. Right? Congratulations, it's been a real pleasure.
Thank you, thank you, thank you.
Great. Like an MRI I'm going through. See that? Scanning through. Like you know how Khalil would do with the teeth, right?
Mm-hmm.
Scanning through, and I'm seeing your lens is perfectly clear, so our idea to correct your cornea was right. And then I'm seeing the impact of the rest of your eye. Even though your eye has an abnormal impact of vision, you're at 20/20. Right? Your numbers are 0.31 coming from -7. Does that make sense?
Oh, yeah.
This shows me the zone. Now here's the fun thing that this does. It actually breaks down each of your impact factors in the eye, the cornea, the lens, and the back segment. Tells me how each factor sees. In your husband, this is where I'm thinking the major issue is, because he's a presbyope, right? In your case, you are now perfected to this, and I'm just monitoring you. Ashley, been a pleasure.
Yes.
Enjoy your better than 20/20 vision. Amazing, amazing.
Yes.
But you see the concept actually where this is headed to the future.